Welcome to your surgery clinic YouTube channel. I started this YouTube channel purely to improve the patient quality of care, and I hope through this video I can improve your understanding about the surgery you're about to have, and you more importantly feel comfortable going through this process. First, I'm talking about gallbladder surgery. It's called the laparoscopic cholecystectomy. Fairly common procedures, frequently done at any of the institution. And first I would like to explain about what to expect. Surgery usually takes a little less than 2 hours. Recovery usually takes about 2-3 hours after the surgery. As long as you eat, as long as your pain is controlled, you feel comfortable, I will discharge you on the same day. Most of my gallbladder surgeries are scheduled as the elective procedures, meaning patient comes in the morning, get the surgery, get discharged on the same day. After the operation, along your incision, you will have steri strip. This will stay about 2 weeks. Do not peel off, just let it fall off. It will come off in 2 weeks. Daily shower is okay. After 24 hours, the surgery, no submerging into the water. This is purely to prevent any potential infection to your incisions. In terms of diet, right after the surgery, I will start the clear liquid diet. Clear liquid diet is something soup, broth, something really light. As long as you can tolerate those, I will discharge. Of course, we have to make sure your pain is controlled, you feel comfortable. Some patients decide to stay overnight, depending on how their progress after the operation. Wound care, as I said, you will have a steri strip. Don't peel it off, just let it be. If you notice any discharge, purulent drainage, if something is concerned, please do not hesitate, call my office. Limitations, these are the type of questions that everybody asks pretty frequently. What's the lifting limitation? I usually say no more than 15 pounds. In my instruction, which you will get, or you already have one, to make sure you understand each information. Even though this is a laparoscopic and minimal invasive procedure, it takes a while to completely heal back to where you are. When to call, this is very important for each one of my patients. If you do have a fever above 1 or 1.4, uncontrolled pain, inability to tolerate any oral intake, food, liquid, this is very unusual. Shortness of breath, new onset of shortness of breath, chest tightness, chest pain, extremely lower leg swelling, persistent nausea. Anesthesia usually lasts for 24 hours or so. After that, usually patient does not have severe nausea. If you continue to have nausea and then can't tolerate, that's something you need to let me know. Extreme bruising, extreme pain. I usually prescribe either tramadol or a small dose of T3. This should be sufficient enough to control your pain. It's very flexible when to see follow-up patient. For me, it's either 1 week to 2 weeks. Some patient shows up in 2 weeks. Some patient shows up in 1 week. Some patient want me to check it up in the next couple days. I'm totally flexible. I'm here for you, and you call us. I will be very flexible in terms of that schedule. Next important point is bowel care. Ideal situation before going to the surgery, try to avoid constipation. If you are constipated to start with, anesthesia slows down the bowel movement, surgery itself slows down the bowel movement, pain medication causes slow down the bowel movement, all causes going towards the constipation. I specifically wrote in my pre-op instruction, try to start the bowel regimen even before the surgery. Try to have a good bowel movement to facilitate the process even before the surgery. This really helps for entire recovery as well. Stool softeners, Colace, Doxate, laxative. These are the stuff that I usually recommend, and it's specifically written in my instruction here. Lastly, a follow-up appointment is extremely important to make sure your incision is healing well, you are tolerating well. Is there something expected, unexpected? These are the stuff that I have to make sure that your safety, you are completely recovering, and most importantly, your pain is gone. I wanted to make sure that all small checkbox has been checked before I will complete your care. Usual follow-up appointment, I will follow up in 2 weeks. As I mentioned previously, it's normal. 1 to 2 weeks follow-up is usual. And this will conclude my instruction for a gallbladder surgery. Some of the detail I was not able to cover, but if you are able to pick up from my office this packet for the gallbladder surgery, hope this will facilitate the whole process of your surgery. I'm really hoping that you feel comfortable going through these procedures. If you have any question, please call my office. Okay? All right, then see you on the surgery day. Thank you so much for watching, and I hope this will help for your understanding going through your procedures.